So yes, my name is Shana Reines. I am from the district. I work in Medina Memorial Hospital. As you see, we're all come here to share our stories about our concerns and our frustrations and our fear for the Medicaid cuts. I just wanted to talk to you. I'm going to share my story, but I know I want to level with you guys. I know that this is also a business. You know, you've got a lot of things on your plate. There's a lot of things you've got to consider for the American people. And I just want to step in and I just want you guys, my biggest thing, my biggest fight here is that I want you to look at it as a whole. To cut healthcare, to cut any kind of funding for healthcare just seems kind of funny because how do you know you're not going to break your leg? How do you know you're not going to be my next patient? You don't know. You may have great health insurance here, you know, you may have a great pension, you may be fine, but like what about your sister, your sister's kids, your mom, your grandmother? Can you afford all of them on top of your own health care? Can they? That's really the fear, the concern. I myself, I'm a working woman. I've worked, I was a single mom. I held 5 jobs while working, while taking care of my kids. I depended on Medicaid. I've got 3 autistic sons who all need something. And there's nothing wrong like with them. There's nothing, you know, autism isn't something that's like stopping them from becoming, you know, the future president, the next Elon Musk, the next Steve Jobs. But Medicaid funds their IEP, it funds their speech, it funds their occupational so that they can unleash their hidden superpowers so that they can become these great things. Because all of the super incredible people in our lives, Einstein, Steve Jobs, Elon Musk, Trump, all of them, they all have these hidden superpowers, right? Their brains work differently. That's what makes them so great. That's why they get to the top. So why prohibit, why cut funding to all these things that support these kids, your next voters, your next supporters, your next presidents, you know, the next people in line to take care of you? Why cut funding to that? And then I myself, I'm a PCT, like I said, on top of my floor. Like nurses, you know, they get a cap, they get 5 to 7 patients at a time. I don't. I, as a PCT, have the entire floor. So I have all 32, 22 patients that are here. And even if I have 10 patients, that gives me 6 minutes every hour to meet with each patient. So that gives me 6 minutes to dedicate to every patient. That's impossible. Your grandmother can't go to the bathroom, brush her teeth, get dressed, do her dentures and everything in 6 minutes. That's not enough time. That's also not humane. That's not humane enough for me to come in and say, hi, how are you? Do you need anything? Do you need a snack? You know, that's not fair to them. And when I go up to my management team and I say, hey, like I'm struggling here. It's just me. What are we going to do about this? You know, they're like, well, we're trying, but we can't afford more staff. We don't have the funding for more staff. So that not only leads to burnout, it leads to shortages, it leads to not being able to give the basic human rights, like care, basic needs of care to people. So in my mind, cutting funding to healthcare makes no sense because like I said, like, how do you know you're not the next patient? How do you know, when you have kids, you don't just decide I'm gonna have a kid with disabilities. I'm not gonna have a kid who needs $5,000 a month medication. It's just something that happens. We don't pick and choose these struggles. And as far as the waste and abuse, like I said, I'm a working mom. I was a working single mom. I worked 5 jobs. I didn't just live off the government for free. I worked my butt off day and night to make sure that I had everything that I needed for my kids. And I still do that. I work 100-hour pay periods just so that, you know, I can help my fellow, you know, people on the floor, my fellow staff, and make sure that all the needs are met.
Absolutely.
But that's my story. That's where I wanted to come in.
Thank you.
Thank you. And I hope that we have your support.
No, absolutely.
Thank you.